Absolutely.
All right, let's get started. Georgia, can you please call the roll for attendance?
Yes. Counselor Gonzalez,
Morning, President.
Counselor Lewis,
Present.
Counselor Nolan.
Present.
Counselor Rosenthal is going to be a couple minutes late. Counselor Simpson is excused and Council President Peterson is excused. Deputy Council President Wong.
Present. Okay, before we begin our agenda items, can we please play the safety video for our in-person attendees?
Are located on the third floor. In the event of a fire or fire alarm, please exit through the door in the northeast corner of the room. Go down the stairway to the second floor, exit through the main entrance by the reception desk, and gather in the courtyard outside that entrance. In the event of a medical or fire emergency, please call 911 and notify the security agent at the reception desk. The nearest defibrillator is mounted on the steps leading from the reception desk down to Grand Avenue. Thank you, and come visit us at Portland 5.
Okay, we'll move into our business items. Today we have Support Housing Services County Annual Reports for fiscal year 25. Today we welcome back staff from Metro's Housing Department to provide an updated report on supportive housing services from the 3 counties. Housing staff joined us in September with the Q4 reports. Today we will hear the findings from the finalized annual reports for year ending June 30th, 2024. Metro's primary role in SHS implementation is to provide accountability and oversight of tax revenue and progress towards commitments made to the voters, and to convene and coordinate long-term regional solutions. And I just want to first thank all the counselors for their flexibility and coming back to a meeting this morning, and apologies to the housing team for delaying this to this week, but thank you for being here today. Today we have Patricia Rojas, the Housing Director, for the presentation.
Okay, it should be on now. Okay, great. All right. Good morning, Metro Council. My name is Patricia Rojas. I use she and her pronouns. I'm the Regional Housing Director here at Metro, and I'm joined by Liam Frost, our Deputy Director, for questions afterwards. We are pleased today to bring you a high-level review of the Clackamas, Washington, and Multnomah County annual reports covering the period between July of 2023 through June of 2024. The Supportive Housing Services Work Plan adopted by Metro Council in 2020 requires that counties submit a comprehensive report on October 31st of each year. These reports provide key county-level information about performance and financial expenditures for the previous fiscal year. Today's presentation is a truncated version of the presentation county partners presented at the November 4th Supportive Housing Services Oversight Committee meeting. Each county presented financial information differently in the Oversight Committee meeting. So in the interest of consistency and brevity, Metro staff will share high-level revenue expenditure information based on the reports that counties submitted. We are in the process of evaluating the data that is in those reports, so I would consider these as preliminary, as we are regularly, so far, have been getting updates to that data, and we'll make corrections through the annual report that is regional. Today's presentation is not an analysis of county performance. The Metro SHS Work Plan requires that the Oversight Committee also present an annual regional report that does assess performance, challenges, and opportunities. It may also include recommendations to Metro Council for implementation improvements or changes to LIPs, local implementation plans. With the support of staff, the Supportive Housing Oversight Committee has begun its annual process of analyzing the information provided in county annual reports and are developing the regional report. The Oversight Committee will meet multiple times in December and in January with the intention of completing the final draft in February. The Oversight Committee will present that report to Metro Council and the Boards of Commissioners beginning in March. I want to acknowledge that this report is being presented to you today, 5 months after the end of the last fiscal year, which, as the auditor pointed out in the last year Supportive Housing Services audit, is far too long. Council is currently considering several improvements to the Supportive Housing Services program. We knew that starting a program unlike any other in our nation was going to require bold action while maintaining the humble commitment to continuous improvement. Improving how we do this work, and more importantly, seeking to improve outcomes for those that we serve. In the spirit of that commitment to continuous improvement, the COO's recommendation shared with you in July highlights challenges and opportunities to improve our governance structures and operational processes, such as this one with reporting timelines, data collection, evaluation, and other governance-related areas. I would like to thank our Metro staff team, our housing department team, for the hard work that they've put into this process to expedite the regional reports year over year. The first annual report that was presented was presented to you in June and July after the first year of implementation. And this year, we will complete the report in February. That means that jurisdictional partners will have the opportunity to utilize this critical data in programmatic planning and budgeting for this upcoming fiscal year. So thank you, team. While we must continue to act on opportunities to improve this work, there is also a reason to celebrate. We're making progress towards keeping our promises to the voters and are, more importantly, helping people find housing stability. SHS has helped tens of thousands of folks avoid homelessness by staying housed, and more have exited homelessness and now have a safe and stable place to call home. So now I would like to dive into the data itself. Next slide, please. The county annual reports include programmatic data and a racial equity analysis on their housing services programs, information on population served, and it sheds lights on partnerships and work being done with the nonprofit community, such as capacity building investments. It provides information on the infrastructure that is being built across the region, and it also gives a cross-sector view of the coordination that is happening between counties. And of course, it also gives a financial assessment of the progress that is being made in each county. For the purpose of today, I'll just say that all of that information is available to you in the reports from each county. Today, what we're going to touch on is outcomes for PSH, rapid rehousing, eviction prevention, shelter, along with a few other outcomes. And I'll also be discussing population A and B populations with a financial overview. Next slide, please. As we close out the third year, the annual reports provide a portrait of progress in addressing the region's homelessness crisis. Though the number of households entering homelessness continues to present a challenge in our community, thousands of people have found stability in avoiding homelessness or in getting housed over the last 3 years. This slide includes high-level numbers that are, again, are preliminary for what we have accomplished since the inception of this program. So almost 7,000 households have been placed into housing. Over 15,000 households have been able to retain their housing through eviction prevention. Over 1,430 shelter beds have either been open or sustained through SHS funding. And 2,854 households are living in safe and stable housing with the support of the Regional Long-Term Rent Assistance Program as part of SHS. Next slide, please.
Excuse me, Mr. Chair.
Yes.
Clarification. Ms. Rojas, on that previous slide, how many of each of those categories are population A?
So that is something that is in the report itself. But I do have a slide that's mostly financial information that is provided, but they do break down each service category area in the report by populations A and B.
So is there a quick sneak preview?
Let me see what we can pull up
Are
in
we
this.
spending 75% of the money on population A?
We will talk about that in just a moment.
Okay.
Yeah, you're flattering where I'm going with this. Okay, this slide provides a regional progress to goal snapshot for FY24. The annual reports data confirms the preliminary numbers for Q4, that this is what primarily we saw a few months ago. Overall, the region only fell short in the supportive housing services work plan goal, which is nonetheless, they did come very close to achieving. We did, however, have overwhelming success at meeting several other goals. Progress from the previous year matched the pattern that we see in terms of hitting the work plan goals. Prevention and rapid rehousing placements were well exceeded. So Councilor Nolan, to your question, prevention and rapid rehousing typically is population B, just for reference. You'll also see here that retention rates for PSH and rapid rehousing are also higher than what they set as goals. And by retention rates, what I'm referring to is who has retained housing after 12 months of placement. The region also continues to see expansion in shelter capacity that is funded by supportive housing services. And you see here that there are over 2,000 households that are currently being supported or that were supported with the long-term rent assistance program that we have. Next slide, please. Now I'll shift over to county-specific data. Clackamas County has exceeded all of its quantitative goals for fiscal year 23-24. Almost 90%, sorry, my computer's doing funny things. Almost 90% of meeting their regional PSH goals. So every local implementation plan that was created by the county set 10-year goals for permanent supportive housing units to be created. So for them, they're at 90% of that goal. Clackamas County reported that supportive housing services funds has helped Clackamas County in reaching these higher numbers in the listed program areas. Clackamas County also now has a coordinated county-wide street outreach program that's funded by SHS, and over 500 households were contacted and had some support through that outreach program, even though the goal was not part of their annual work plan. Next slide, please. Multnomah County came very close to reaching PSH placement goals, but fell short by 10%. Multnomah County missed their homeless prevention goals that were set for last year. Regardless, Multnomah County excelled in placing households into rapid rehousing, almost double their annual work plan and more than double last year's rapid rehousing placements. Currently, they are at 68% of their 10-year LIP goal for supportive housing supportive housing placements. And additionally, they are serving higher rates of BIPOC community members versus those. So the representation of folks in their service programs are higher than folks experiencing homelessness, the percentage in the general homelessness population. And then they also reached a record number of people moving into housing from homelessness last fiscal year. Next slide, please. Washington County missed 2 of their work plan goals around PSH and rapid rehousing. This comes after last year's success in exceeding that supportive housing goal. In terms of setting up their SHS rapid rehousing program and meeting their work plan goals, it continues to be a slow start for Washington County. They're continuing to refine their rapid rehousing program in order to reach this goal. Regardless, Washington County also far exceeded their annual work plan goals for homelessness prevention and shelter units. They built on last year's success, almost quadrupling the previous fiscal year's prevention placements or prevention households served. They've met 77% of their 10-year SHS permanent supportive housing goals. And a few more highlights for them would be that more than 10,000 people have been supported by SHS funds. More than 1,200 people have moved from homelessness into housing, and they have stabilized over 4,400 individuals. Next slide, please. One critical component of the supportive housing services program is the prioritization of services for people experiencing prolonged homelessness with complex disabilities. This priority is reflected in the allocation requirements for supportive housing services funds, as stated in the Metro Supportive Housing Services Work Plan adopted by Metro Council in 2020. And it is also reflected in local implementation plans and intergovernmental agreements. Since the start of the supportive housing services implementation, there was a recognition by all parties that consistent reporting on this financial expenditure split would take some additional time, as it required the development of a shared and consistent methodology between the 3 counties. This information, therefore, was not included in the first-year annual report. For fiscal year 22-23, counties provided financial information after the reports were due, but the Supportive Housing Services Oversight Committee was not able to conduct regional analysis due to the variability in the reporting of service types, data availability, assumptions, and allocation methodologies. So in order to build out that consistent reporting, the Supportive Housing Services Oversight Committee in the regional report recommended to Metro Council and requested from counties directly that counties submit population A and B financial split data on a similar template using same methodologies, same definitions and practices. And so Metro staff, with direction with the Supportive Housing Oversight Committee, provided a template to counties in early June for the implementation with the FY24 with last year's annual report. So that's what we're seeing or upcoming. Our finance manager developed the reporting template and requested feedback from counties. Additional changes were incorporated based on that feedback. In mid-October, county staff informed us that they would not use this template. Our team has and will continue to remain committed to problem solving and removing barriers to data collection and reporting. Last year, Auditor Evans released an audit that found inconsistencies in how counties are applying definitions and as well as how counties track and report data. In response to that recommendation, Metro staff from the Housing Department provided counties with several tools that clarified the 5,000 and 10,000 goals. We sent clarifying information about the definitions of populations A and B, provided tools that could be used as intake forms so that we're better able to identify and report on who qualifies as population A and B. And of course, we updated the reporting templates. We're still trying to gain traction on a lot of these areas. But again, we remain committed to making sure that we are able to demonstrate that we are in compliance with our own regulations and requirements of this program and that we are delivering what we promised to the voters. Next slide, please. This slide provides an overview of what was submitted by the counties this year for population A and B financial data, the split for that financial data. Counties chose to use their own reporting templates, so it varies county by county. And we've aggregated on this table all of the information that counties provided us for this year. You'll see that there are blank cells, which reflects just the lack of alignment between the counties. And again, I just want to reiterate, this is not an apples to apples comparison. There are different methodologies and ways that the counties are approaching data collection and reporting.
Excuse me. Are these percentages of funding or of people?
So this is percentages of funding by population.
Okay.
So as you can see here, all of the counties reported on permanent supportive housing placements due to the inconsistencies in county data tracking and reporting and challenges that we've had in gaining access to supportive housing system and client level data. Regional analysis is going to be difficult. The information here mostly does not align with budgeted program categories, either because of how counties categorize services themselves or because they didn't include system support or admin costs in their information that they submitted. So again, Housing Department staff is working with the co-chairs of the Oversight Committee as well as county staff on next steps to be able to have access to the data that is accurately conveying financial investments by populations A and B by service area. Next slide, please. As I mentioned in my opening remarks, each county had their own presentations, which is where the majority of this deck was pulled from. This is their presentation to the Oversight Committee. However, when it came to the financial overview section, counties spoke to data finances very differently. So they chose to talk about different things and in different ways. So we've created a slide, one singular slide based on the data in their reports in a way that does at least get us a little bit more to that apples to apples comparison. The slide represents for each county their FY24 distribution, their expenditures, prior year carryover, and other revenue. County's FY24 revenue totals include $309.8 million in tax collections and almost $350 million in prior year carryover, plus other revenues such as interest earnings, grants, et cetera. Counties spent 80% of resources budgeted for program costs, and county spending increased from this year from previous year. So it's been increasing year over year. The ending fund balance, which is revenue that would carry over from one fiscal year into the next fiscal year, was similar to FY22-23. Some of this will be allocated to different reserves and contingency accounts, and counties have plans to spend down the rest of carryover over the next several years as one-time investments.
Mr. Chair. The three counties each have to have side accounts for the Regional Investment Fund as well as their reserve account. Are those two accounts represented in blue or the olive or not on this chart?
So it would be part of the FY '24 distributions. So usually that they have the counties, and I have to double check because it is different by county where what they actually have their reserves to. Yeah, Jane Marie can talk a little bit more about that.
Hi, Jane Marie Ford, her interim finance manager for housing. So the actual expenditures are showing their costs that went out the door. So the reserves are not included in that to the extent that they didn't draw those down, which they didn't. So the expenditures are actual program expenditures. And then that's why it's a little hard to show all in one chart. But you can see on the revenue side, the distributions, current year distributions plus the carryover is the total revenue. So that's going to be part of their ending fund balance. If they didn't spend down any reserves, which they didn't, it carries over as revenue into the next year. And that's being budgeted partially again for reserves and partially for program costs.
Great, thank you. I just want to say, I think a lot of what we're trying to have conversations about are the blue bars versus the green bars versus the gray bars. And the idea that there is potentially up to 15% that is not recognized as a healthy thing like the blue is going to give us some trouble if we don't recognize it up front. That 15% is probably about the number we would expect, maybe a percentage point or more. But the significant magnitude of that gray bar being the question at hand. So thank you.
Okay. Next slide, please. Okay, so now I will turn quickly to our next steps in the development of the annual regional report that the Oversight Committee is working on. So you see here, the kickoff really is the receipt of the annual reports from the counties, which is the main source of data that we use to create the analysis and develop the annual report at a regional level. On the 4th, you see that the counties presented their reports to the Regional Oversight Committee. Between now and the end of January, there will be, I think, 4 meetings that the Oversight Committee will participate in to develop the annual report. And then we will, with the goal of finishing the report, having a final draft in February, and then presentations will begin to Metro Council as well as the boards of commissioners for each county in March. So, and again, I just want to recognize that this timeline is quite a ways out from where we would want it to be, which would be much closer to the end of the fiscal year. And, we have made significant improvement on that timeline and will continue to do so. But at that, I'll open it up for questions.
Mr. Chair. Thank you. I don't know if you have the information handy here, but at some point, I'd really like to dig deeper into the question of investments in population A and population B. What we need to do to make sure that the numbers we're getting from each county we can realistically use for comparisons. Are they using the exact same definitions? Where are you in that? And then I'll want to talk also about shared database or get you to talk about it.
Yes, that's a great question. So we can definitely follow up with more information on investments by population A and B based on what they gave us in the reports. And as I mentioned in the presentation, there are variations currently of how each county is defining and how they're tracking and how they're reporting, which makes it really challenging for us, and which is one of the primary goals that we have currently we worked on last year was to try to create some tools that help kind of cut through some of those inconsistencies and get us to a place where the definitions that you have set forward through the work plan are being applied across all 3 counties. So we do know that that isn't happening at this point, and to get a better sense of what that really looks like, we would need to have access to data in the Homelessness Management Information System, otherwise known as HMIS, which we have been working to try to gain access to through a data sharing agreement, and we have found challenges in getting there. So in order to really truly answer your question, we would need to have access to raw data in HMIS as a starting point. And then we would need to conduct some program evaluation as well and monitoring, both of which are responsibilities of Metro in the IGA. But again, we have been in negotiations for how those functions are exercised with counties.
Couple of follow-ups, if I might, or
Please.
This is another one you can think about. Ms. Madrigal can help you think about. Are there things this council can do to help you move toward an acknowledgement by the counties that Metro has legitimate interest in and can require data in ways that allow us to be able to confirm that we are actually complying with the letter of the ordinance? If there are things this council can do that would be helpful, let's bring them forward. Secondly, on the definitions, we've established definitions and the counties are not using those definitions. Would I be right to assume that the counties are instead deploying definitions that allow them to count more people in population A than they should be?
I would first of all kind of frame this as they're using definitions differently, or the application of the definitions are different by county. So they're each slightly different in how they are talking about and defining, whether it be populations or service areas as well. So there's nuance in there. And there's different ranges of how, I would say, true to the letter folks are being to the definition that we've provided. And to be clear, we provided additional clarity as our work plan and addendum, I believe, 2 of the work plan gives really specific explanations and definitions for populations A and B. So we've provided some additional information there. And I will say that I think if I understand your question correctly, would the way that the definitions are applied, could that lead to more, for example, folks being served in population B? Is that, am I understanding your question correctly?
No, it's my suspicious nature coming through. It's my experience that people don't fudge the definitions except to their advantage. They don't normally fudge them in a way that puts them in a poorer light. So since we've got an obligation to spend 75% of the funds on population A, my question is, do we have any reason to believe that some counties are counting in population A people that do not fit the definition that's within our work plan?
I'll just say, I think it's possible. And I'll say that the way that we would, or I'll say the way that a funder normally evaluates this is through something called monitoring. So funders, the state, the feds, funders' general practices will go into an organization that they fund and seek to see how they are actually meeting the requirements. Show me through your data, show me through your intake, et cetera. So it would be through monitoring that we could give you a much more definite yes or no. But I will just say, given the variation that we see in what we have been provided and where the counties are saying, this is how we are categorizing. So for example, I think that Clackamas County is using PSH, just the number of people that they're counting in PSH as a proxy for population A. So that's one example where, Multnomah County might be looking at intakes regarding looking for different pieces of how they're defining or how the definition of chronic homelessness, for example, is being applied. So they're all slightly different. So while to your question, would there be a reason to be concerned about that? I think there is a reason to be concerned about that, simply due because of the inconsistency. So, and without us having the ability to go in and kind of take a look at what their practices are, what the data actually says in HMIS, it's very difficult to confirm one way or the other.
And just to add to that, to answer your question directly, we just simply don't know. And it could be through the motivations you just speculated on. It could be that the counties are doing the best they can. It's just that we don't know. Patricia mentioned monitoring. I think one of the most significant tools in our tool belt would be the data sharing agreement, which still has not been agreed upon. And that is really stalling our ability to validate data at a micro level and to answer questions like the question you just posed.
And I have other questions, but I'll defer. But I will just wrap up with, you referenced standard funder expectations. I don't know of another funder, private foundation or government, that gives money other than in gifts without performance expectations and the access to data to demonstrate that they are or aren't met. We have to change this.
Liam, can you explain why we don't have a data sharing agreement yet?
Yes, I'll start and.
No,
feel
no,
free to
please,
hop
I'm
in.
not in negotiations anymore.
So our intergovernmental agreements, and I'll just kind of back up and actually kind of highlight some of the pieces that were highlighted in the COO recommendation. And one of the themes that it was talked about in that recommendation was the starting place assumption when we kicked off this work, which was that counties have the infrastructure, the expertise. We have a pandemic that's raging in the community and need was great. And so we ended up with an agreement, an intergovernmental agreement that essentially assumed coordination, collaboration, and agreement on just about everything. So, for example, for monitoring agreement or data sharing, we have to agree to the terms. And same is true for monitoring, program evaluation, any of the other functions that normally reside with the funder. So to your point, Councilor Nolan, I have not seen a funder that actually negotiates the term of their monitoring practices with their fundee, or program evaluation for that matter. So I'll just say, while the intent was, I mean, there were good intentions at the start of this, of like, we have to be responsive right now to the need, and we're going to work together to do this well. I think what we have found is that we have to have very clear roles and responsibilities, funding recipient, and really defining what that is. And that is where I believe we have a lot of room to improve.
I find it just, basically impossible to provide proper oversight of this if we aren't getting, apples to apples comparisons from the counties. And, I had a career in the corporate world. I do my own taxes, I work at a nonprofit, and our reports are designated by a funder. And if you don't do those reports, there are consequences. And just find it unacceptable that the counties participated in that process of creating basic forms to report on and then didn't use them. Can you explain why they didn't use them and what the plan is now?
Yes. So what we understand from counties was, I think that there were challenges inside an institution of who saw what templates or reports. So like we sent those templates and talked to staff at the staff level. We submit those to the appropriate representative of each county. And in some cases, perhaps that was not actually vetted. And so what we're hearing is that there's challenges in how HMIS can or can't be responsive to the template requirements, timing challenges.
Everyone uses the same HMIS?
Yes, they do.
Why do some people have challenges and why do other people don't?
So this might actually be a good question for Hunter, but I'll just say that, again, I think that there is ability to implement these tools. I think that there was time for counties to say, hey, I'm having this challenge and how this would be applied. This is a potential consequence. And so I think we have yet to learn exactly what those details are. And I think the highest level explanation is that there's some kind of inconsistency with HMIS. And I'll just say our data lead, who is an expert in HMIS, has verified with us that indeed that there are not significant challenges, and it is aligned with practices that the counties have. And so I'm looking at Hunter making sure that I'm not speaking out of turn. I'm getting a head nod.
So is it just incompetence or ill will, or what is?
I'll just say, I don't want to make assumptions of what the motivations are. I just want to solve the issue. And so I think that we're at a point where you're absolutely right in your frustration and the concerns. And I will say the Oversight Committee also shares your concerns, as does the Tri-County Planning Body. And so I'll just bring us up to our existing conversations around making changes to how we think about governance and how we actually establish clearer roles and expectations, definitions and tools, so very similar to what other funders do. And so I think that I'll just say we don't need to reinvent the wheel, and we have a lot of good practices out there that we can lean on in any future improvements.
And do we expect the counties to be using the agreed upon forms next year?
Yes, that is the stated expectation. Yes.
Okay. Councilor Lewis.
Sure, thank you so much. I want to appreciate first that you're in kind of a weird position of presenting work that is not your work. I have the luck and good fortune of having sat through 3 hours of presentation to the Oversight Committee, where 1 hour at a time, it was county staff in the hot seat and not in the seat you're in now. But from the Oversight Committee, the questions were a mix of softballs and spice, because obviously you have a group of folks who are oriented towards the county that they represent and want to dig in deeply in their home turf, and maybe are a little bit less territorial for the other reports. So situationally, you're in a hard position defending work that at a granular level is very good, but at a reporting and systems level is mediocre at best. You've outlined a little bit some of the problems with reporting on population A and B, and why that is so critical is because that is the major metric in which we promise the voters we're going to target this money on folks who need it the most, the people experiencing chronic homelessness who have not one but probably 2 challenges and will need help finding stability. So if that basic premise is not being maintained and the efficacy of not only the programs that get funded, but how county staff are working, that's a big problem. And if I were offered the opportunity to vote up or down, it would be down today. I do think regarding the form that we submitted, and my understanding was that we had broad agreement from financial type staff. It was housing practitioners who gave pushback. I would be curious if we've thought about actually just requesting through a public record request that information. I was a public employee for 4 years. I remember everything that I typed being public records requestable. Why, if we care so deeply about making sure that we are the backstop for the voters who pay their taxes to us, have we not gotten this data, no matter what it shows? Okay, off the soapbox.
Amen.
I do have a real question here. In the Oversight Committee meeting, there were themes. Data was one of them. We've been there. But the other is around correction of course, learning, and deeply understanding community needs. So when I heard one Oversight Committee member, Peter Rosenblatt, bring up that the Community Advisory Committee was of concern to him because it had been basically renamed but not reformed. First of all, that was a brand new concern that we had never heard. And we had no way of knowing because it is unknowable through data. What other blind spots do we have in terms of our commitment and the assumed program that as much as it might be renamed on paper, what are we blind to?
That is a fantastic question, Councilor Lewis. And again, this kind of process improvement and I'll just say oversight responsibility to make sure that you don't have these big gaps, that you are indeed following the requirements of the measure, of the program, and of the commitments that have been made. In a way, it's kind of understood vis-a-vis a set of tools. Reporting is a tool. Program evaluation is another tool. Monitoring is a tool, and they actually work together, right? So if you, for example, if our interest is to understand how well counties are complying with the requirements of this program, we would go in and actually look at a variety of tools, whether it be HMIS data or even financial records, to understand how finances are being tracked and defined. And we would extract from that an understanding in a variety of implementation areas what is happening. So are we in compliance or not? Are you doing what you said you would do? And then that's where we start to see red flags, if potentially, which we would then go deeper and evaluate what is actually happening. Like, is the thing that we said we do actually working, right? And so and then there's your reporting tools. Having access to something like the client level data and system level data and HMIS is another area where we would have access to information that we could draw conclusions and see where there might be holes. So I think that there are a variety of areas. So some are quantitative, some are qualitative. And so we have to make sure that we are indeed capturing all of those pieces. We do have a process to try to update templates and practices every year. So I think that to answer your question, we always need to be asking the question is the main point. And we have to have tools that allow us to be able to answer the question and then correct for any issues that we might see, fill any holes that might exist, and address any deficiencies in a timely manner.
I won't jump in and speculate on the unknowns, but one of the known unknowns is the rest of the budget and the rest of the funding and how SHS leverages those other pieces. And not just leverages, how does it fit into a larger system of care for folks experiencing housing instability and homelessness is something we don't see. And then there's the timing issue that Patricia spoke about at the beginning of the presentation. We're talking about it now. It's FY24. The report's coming to you early next year. Having that delay means that we're not having line of sight of what's coming up now. We're having some line of sight of what happened a year ago, just to double down on the lack of vision that we have.
Thank you. And I think that the known unknown of the rest of the budget is a real challenge. In particular, thinking through how folks who are not meeting the definitions of population A and population B are being served. There's somebody who's homeless in community I represent, who has regularly been taken to a 13,000 member community board, and they have managed to keep themselves housed in a motel at $65 a night because those 13,000 people are stepping up. And it's Clackamas County Housing Services that continue to tell them there is no family shelter there at the back of the line. So because they're not meeting the definitions of A and B, their family is getting housed because of the goodwill of the community. We have solved for something, but we've not fixed the system.
Councilor Gonzalez.
What a conversation. I appreciate the flexibility to bring this now. I just want to first and foremost echo everything that has been shared. And especially when I hear Councilor Lewis sharing reflections and thoughts as our rep on SHS oversight in our committees, and the kind of pointing out some of those areas that it really continues to rise it. So thank you, Councilor, for your hard work on that. The question around data sharing, I think is one that I want to throw my hat in the ring and say, from our perspective of not only the programs, the accountability, the definitions, but also being able to measure the regionalization of the system that we promised voters. That to me is where I'm having the hardest time of truly understanding even the direction of the system. It appears to me from the work that we're doing. And also, I do think it's important to recognize that through the reports that were submitted, that people at all levels of the system are working really hard to serve people. And the money is being spent to care for people. And that, like, I think we do need to acknowledge that. At the same time, you know, I get the sense that we have 3 individual systems within one region, not a regional system working aggressively, ferociously to take care of people with the deepest need. So again, that has been expressed already. And Liam, you kind of teed up my question here in terms of, you know, our ability to look at the whole continuum of care, look at the resources in the region. This is an issue of regional significance that the voters have affirmed now multiple times. And understanding for this regional system, I mean, there's things like the Medicaid waiver coming online. CCOs are like flowing with money. Like, how are we deploying this? Our healthcare providers, our healthcare system. And to me, this conversation, we're having it in, you know, also recognizing that we're in the process of potentially referring something to the ballot, looking at reforms and things like that to this measure. So I think the question that, and the data, the information building and kind of wrapping up things that folks have shared is, when we look at the continuum, the housing continuum, the system of care, it's like, what is the mission of the SHS measure, and how can we point that really strategically? Anyway, that I'm realizing there wasn't really a question there, but my peers, to be fair, have asked the questions that I think need to be asked. And I'm gonna I wrote this down and underlined it. As we continue to revision and refocus, recalibrate the SHS measure for the future, it's like, let's make sure that we're not renaming things without reforming them, and actually trying to build a joint and shared understanding across all partners, all sectors. If there was a question that I would ask, it's around, you know, our 6 priorities from the TCPB, and looking through the annual reports, there's different things mentioned around how those things are being advanced. And I guess I'm wondering how some of those things, contracting, wages, things like that, from your perspective, having evaluated all of them, how are we measuring the success of that right now? And again, because I don't feel like we truly have a regional system, do we assign grades per county instead of per region? That's a question long-term for these regional priorities, and how we're actually lifting them up. Thanks.
Thanks for the question, Councillor. When it comes to the regional alignment, the regional vision of SHS, the work of the Tri-County Planning Body and the team that supports them is like the nucleus. That's where that change is meant to happen. And I think, as Councillor Lewis has experienced over the last 2 years, the TCPB, we're in a very transitional moment right now. So we've had 2 of the goals approved for actual implementation. Our team is working with county staff to bring back 4 more in the coming months. And there have been some challenges in terms of unifying our vision for the region and bringing together county staff to go beyond alignment and coordination, but actual integration and advancing a regional vision. I'll say, though, we are making big leaps forward. There is recognition now among all 4 jurisdictions around the regional implementation fund or investment fund, my apologies, that as we've approved these goals, it's now time to make sure that this is treated as a fund, even though it lives in 3 separate jurisdictions, which makes it technically difficult. But we're in an understanding now that this is the path forward and how we need to move. We have agreement on that. I think that's a big accomplishment in the context of the rest of our work with SHS. In terms of actual systems change, I'm particularly most excited about the healthcare alignment. We have Ruth Atkins on our team working and leading that work right now. It's a many-headed hydra. It's complex, but we have real, actual, tangible pieces to advance. But I can't spoil that right now because that is being prepared for the TCPB first. But I'm happy to brief you in person one-on-one on the advancements that they're making there. But that one I feel really confident about. There are some others I feel less confident about, to be honest.
And I will just add that in the regional annual report this year, there will be a section that updates on the Tri-County planning body work, on the regionalization work.
Mhm.
And we will also include for the first time an analysis on our progress towards our regional outcome metrics that were noted in the work plan, which are different than LIP goals and annual work plan goals. These are essentially the system and community transformation goals that were incorporated into the work plan. So that will be part of it as well.
And Councillor, I'd be remiss if I didn't mention that two of the goals, Metro staff is leading. And so we have clear line of sight of how those goals are moving forward. I feel very confident in how they move forward. That's technical assistance and training.
Thanks. Can I ask another question, Deputy President Wong? Thank you for that. Kind of shifting gears a little bit to the Pop A, Pop B thing, which I know you hear from me a lot and from many of us on the council. And I want to ask a question that is like in a yes, no framework. You know, a year ago, the council really started to amplify our voices and our concerns around the lack of the spending acceleration not being at the level of the crisis and things like that. And one of my worries of that, one of the consequences of us sharing that so publicly was that there was going to be a pressure to then try and spend all of the money. And it's good to spend the money, but necessarily looking and stopping and saying, is the money being spent in the ways that it needs to be spent to advance the vision? And that goes back to what Councillor Nolan has mentioned around Pop A, Pop B. I know what I have mentioned many, many times again. So the question, the yes, no is, as these trends have evolved for spend down, and I know that you've said already that it's hard to really be able to break that down and tell based on finances and where the money is going. Is that a rational worry to have around the system and the money, the pressure to be able to say, hey, we're spending our money, but we're spending most of that money maybe in our Pop B because of, for whatever reason? Is that a rational concern for us to have?
I think that the pressure is real. And so I think that there was pressure from a number of sources regarding the amount of money that was unspent. And really the goal is not to spend money, it is to have outcomes for human beings and system level change at a regional level. And so back again to the idea, it's we need to have the ability to have a regional expectations, regional vision, which I'll say we have some pieces of that we were right, I think. And there are pieces that are missing that don't really allow us to see the whole big picture. So I think we have a lot of work to do in this area, but I think we always seem to be mindful of what is the highest and best use of the dollars. The goal is not to spend every dime down. The question is it reaching the outcomes and goals that was set out by Metro Council, that was asked for by the voters, and that is required of us in our work plans and IGAs. So again, it's a little bit difficult to answer the question without having access to the tools that we need, which we are working on. That is important, but I just wanted to flag for you that really what we all need to be working towards is the common vision of serving people and having better outcomes.
And I'll just clarify, Counselor, we've not required the counties to spend every penny that has come in. You can see from those charts that there's huge carryover. Where we have stepped in, like we did with Multnomah County in the corrective action plan, was when they had budgeted to spend for certain outcomes for the community and they did not get that money out the door and therefore they did not meet those outcomes. That's where we stepped in. You know, you're going to have refinement and get better and better at budgeting. And I think that has gotten better. But I think there's a narrative out there that, Metro is just trying to get people to spend money. So it's gone like, absolutely not.
Yeah. Councillor Nolan.
Thanks, Mr. Chair. I want to get back to the comments you just made about outcomes. I think we need to be defining outcomes in ways that people outside this room, people, working their jobs and helping their kids with homework and getting to soccer practice would recognize. And while the planning metrics for professionals and for those of us who guide it are important, they expect, at least the ones I'm hearing from, some who don't pay this tax and some who do, they expect to be able to see the outcomes on the streets and parks and under overpasses. We're going to have a referendum potentially on how we're doing on that. And there's been some material change in that. But when do we get to having outcomes that are defined like number, how fast is the number of chronically homeless declining? How soon till it gets to functional zero? How fast is the number of households with children who are homeless declining? Things that really talk about the human beings that should be the beneficiaries of this.
Thank you for the question. I think I understand your question. So it's interesting because we have an opportunity we've been talking about KPIs or key performance indicators. And there are already practices out there of where we can actually implement those. So as one example, HUD as a KPI has the length of time that an individual takes in shelter to being housed, right? That is an indicator. There are also indicators around reduction of homelessness and for different funders, right? So chronic homelessness can be an indicator. So I think a couple of things. I think at this stage, we're now entering year 4 of this work. It is a good time for us to reevaluate how well our outcomes, or I'll just say the metrics that we are tracking are helping us understand progress towards the vision that was set out through the measure. So there are KPIs that we can track. We are tracking other metrics. And I'll say the metrics that we have under the regional outcome metrics in aggregate do talk about, essentially tell us about the reduction in chronic homelessness. So there are some of our metrics are on the right track, and we can have more that help us to better articulate, to your point, to the public, how we are making progress towards addressing chronic homelessness.
If I might continue, I'm not necessarily looking for more metrics. KPMs are internal management tools. They are not program evaluation tools. I'm talking about metrics that say, today we have 10,000 people who are homeless. Next year, how much closer to zero are we? Not how many people did we serve, not how many people got rent vouchers, but how are we ending the homeless crisis? And I think they need to coexist. The professionals who manage the program, your team here at Metro and the county teams need to have the input and outflow measurements, but the public needs to know that the compassion they brought to supporting this measure in the first place is achieving something by reducing the homeless population. I'm not sure there's a question in there either. I'm being influenced by my colleague here.
Yeah, love you.
But it also should get to the efficiency by which we can deliver those outcomes. I noticed the opening of a purpose-built shelter in Beaverton that I think is worth celebrating. But the budget nerd in me immediately pulled out my calculator to determine that each one of those beds with no door and a bathroom down the hall costs $230,000 just to build. We can't afford to do that for every homeless person in the region. And that's without even providing services. So the next step is, how do we get people focused on the outcomes that mesh with the voters, which I don't think the voters care about how many shelter beds we provide. They care about whether people have warm, dry places to stay and a place where they can access services. And frankly, I bet most of the voters I know are okay if that's not a brand new building, if it's a repurposed building or more modest. And essentially it comes down to a choice. Do we serve a fraction of the population with high-end facilities, or do we serve everybody with good enough is good enough facilities? And I struggle with that, but even what we've been talking about in terms of asking the voters to look at this over the long haul wouldn't provide the resources it would take. And I don't mean to pick on Beaverton, but it is the most recent example. We're not looking at anything that would provide the resources to do that everywhere for everyone. Especially if we add on top of it $30,000 to $40,000 a year in services for the occupants there. So how do we get to that reality in partnership with the folks who will actually make it happen? Okay, you're ready to say something.
Yeah, I just want to make a comment in response.
This is not a yes or no question.
I'm going to say that I think we're very lucky that we work for Metro. I worked for the city of Portland, I worked at the Housing Bureau, and I worked at Multnomah County at the beginning of the launch of the joint office. But here at Metro, we don't provide direct services, which is a huge benefit for our team to take a look at the entire system. But the bigger benefit is the fact that we have a really well-established sister department in planning. Now, when it comes to preventing the forces or mitigating the forces that force people into homelessness in the first place, we can work with our planning folks, our friends over at planning, to talk about housing coordination. What are the housing innovations that need to happen across the region to make housing more affordable in general? I think the work that the state has assigned Metro through the legislative process is a big step forward. It's not the solution, but to have homelessness and planning under the same roof and working together, I think that's a huge opportunity for us. So I don't think there's an immediate answer to your question or an immediate solution to that question. I will say that I agree with you on the setting the goals. I think having goals is really important because at the end of the day, and I'll pass it over to you then. At the end of the day, the viewpoint from somebody dropping off their kids to soccer and the viewpoint of an advocate and the viewpoint of a housing case manager and the viewpoint of somebody working in the Metro Housing Department, we all have the same goal, which is we don't want to see anybody sleeping outside. We don't. So let's set that goal and we can.
In my backyard.
Oh, well, it's a whole other, I'm not going to step into that right now.
Well, I think that's the goal we have to come to grips with.
I'll just add, I feel like part of what you're raising gets back to something Councilor Gonzalez, you were talking about, which is having 3 different systems versus a regional system of care. Because part of setting a regional plan is that we are agreeing as a region what the vision is for our community and what the best strategies are based on evidence, based on what we know in data is going to help us get there. Because it isn't a particular investment area that's going to solve this. It really is about how we are putting resources together in a variety of investment areas strategically for the region. So that is where I feel like a lot of the opportunity remains, is moving up from what is good for any particular county and thinking about what is good for the entire region and thinking and building the pieces into place around the vision and the goals that it will take to actually implement that vision at a regional level. Because we do have independent systems right now, which is expected because that's where we started. We have 3 different continuums of care in 3 different jurisdictions. So moving towards alignment is important, and we need to do better in terms of establishing a regional vision and having regional expectations and agreements as a region of how we are going to invest those dollars to get to that vision. So I think that is still an opportunity area.
Yeah, for sure. I mean, since the Beaverton Clinic was mentioned, I thought I'd share some thoughts. The Beaverton Clinic, not the clinic, sorry, the Beaverton shelter that opened, there's although it is on the more expensive side, I think to me, what I'm thinking about is that obviously not every shelter is created equal and every shelter will have different levels of service. I mean, the Beaverton shelter has a built-in clinic, will have built-in behavioral health, it's like the full 9 yards with everything that will be provided there. I want to say that I do think that as we build out, as we raise the baseline of shelters, I mean, the capital expense of building a shelter is, it's once, right? You build it, you maintain it, then you operate it. And we do need to be able to, across our region, I think, have different kinds of shelters. But I want to keep the focus that yesterday when I was there and seeing the site, feeling the site, I felt in my heart, this is the highest and best use of the SHS funding at work, leveraging ARPA money, leveraging the funds. And hopefully to me is a part of a coordinated regional system. If someone is sleeping downtown in downtown Portland and they need like real deep triage, that they have a place in the region that they can go as long as it's not outside. And it's not staying outside. So anyway, I don't want to get into my project's a good project. All the other ones those are the ones that are not meeting the goals of the region, because that's not what I'm trying to do. More so trying to reframe that we're going to need different types of shelter doing different types of things. And we should be encouraging that, and also, finding ways to improve our efficiency and do some cost cutting, and then work across an entire region to see who is going to do what's going to go where. Anyway.
That's maybe what I'm seeing or a sense of, and I guess I just want to say I really appreciate your vision for a regional system, which is really what we need. But I think correct me if I'm mischaracterizing anything, but we're really letting, over the years, inconvenience get in the way of good process. And I say that because, we don't have a data sharing agreement because it was inconvenient during the pandemic. And now we don't have a shared reporting document because it was inconvenient this year. And what seems to be happening is, in this work for developing that regional system, for having established practices, we're kicking the can down the road because it's inconvenient right now. And then when it's time to work on that and discuss it, what I'm hearing from counties is now, Metro's trying to make us do all this extra work. We're trying to just do the good work on the ground. Leave us alone, Metro, because we're busy. But we've always kicked that can down. And I really just think that if we all, through this resolution process and governance, if we can establish that system, we'll all be in a happier place and we can all go back to our corners and get back to work. Is that a fair assumption? And I'm wondering, what can we do now to stop kicking that can down the road on the governance changes that we need to see to have that system that, is a sum that's greater than its parts. And I don't think inconvenience is a valid excuse anymore.
Thank you for that characterization, Councillor Wong. I will just say change is hard. And there is a tension between regionalization and local implementation. And we see this in other areas. It's not unique to the housing world. So I'll just say, I'll chalk it up under change is hard and change is required. It is not an option. The vision for this is a regional system of care that better serves the residents of this region who are experiencing homelessness and help folks stay in their housing. And I think in order to do that, there has to be a shift into a different way of thinking about the work And that's not just like theoretical. It comes with operational pieces like clear roles and responsibilities, clear tools, clear definitions, standards of practices, contracts that are similar in very key ways across the region. And so I think to your question of like, what are we doing? What can we do? Because I agree, like change is not an option here. I mean, change is not a choice. It needs to happen. We owe it to the voters of the region and to those we serve to get there. And just acknowledging that this is difficult. I think that you are having the right conversation right now. I think as a council and the COO's recommendation, when you look at what we have here, I think you are having the right conversation, which is how do we make improvements to be able to achieve the vision that we had, but perhaps didn't have all the right pieces in place, that we're staying in a place of learning. And I think you're having the right conversation at the right time. So I would just say, I appreciate very much so. I know much of my team appreciates this conversation as well, as hard as it may be. And again, I just want to normalize that change is hard at any level, and change of this magnitude and with an issue of this complexity. I'm not surprised that we're seeing what we're seeing, and we can and we have to do better.
Councilor Rosenthal.
Thank you, Deputy Chair. I actually have been listening, even though I wasn't showing up on the screen. I appreciate Patricia. I appreciate your recent words. It is hard. I'm a bit more optimistic than some of the conversation has been very interesting. And I think you're right. We have the right conversation going on. It is a work in progress. It is harder than we thought it would be. It's more complicated on the field. But I think as long as we keep our goals the same, and as was noted, the goal is to have impacts on people, not to spend money down. The goal is to reduce this problem. And in the process, at this point in time, it's very hard to be always efficient. Sometimes we have to do things that are just available to do. And sometimes we just have to trust that it's going to work out. So I see us making progress, and I see us continuing to make progress, but it's going to be a work in progress for another 2 years.
Okay, gosh, I just want to reiterate that we're all feeling a lot of urgency for folks that are out in the streets and, in our accountability to voters. So moving along this process with all due haste, inconvenience is not an excuse anymore. But I want to thank you and your team for all the great work you're doing, and thank you to proper staff. These are difficult conversations, and change is difficult, but it's something we have to do. So thank you very much.
Thank you.
Right, we'll move on to COO Communications.
Thank you, Deputy Council President Wong. Just a quick thank you to the Oregon Zoo for hosting Metro's Employee Night at Zoo Nights last night. Thanks to all our employees for braving the weather, the hail, the rain, the cold, whether you're working it or enjoying it last night. There are also still other nights if you missed it. Also wanted to mention that in a celebratory note, Metro was awarded a $1.1 million grant from the Federal Safe Streets for All Planning and Demonstration Grant Program, which supports safety-focused pilot projects and demonstration projects around the country. Metro's project will provide targeted safe route to schools intervention at one high school cluster in the Portland area, the Roosevelt High School cluster in North Portland. This includes 5 elementary schools, 1 middle school, and 1 high school. The 3 focus areas include adult-led support for students walking and rolling to school, creating safer environments for walking and rolling, and ensuring students have skills and tools to walk and roll to school. Activities will include in-classroom education, in particular, ensuring every student knows how to ride a bike by 2nd grade, on-street and on-campus pop-up and demonstration projects to improve safety, annual Adopt a Bike to improve bike access, and walking school buses and bike buses with paid adult leaders at every elementary school. Partners on the project include Portland Public Schools and Portland Bureau of Transportation, Nonprofits Oregon Walks and and Community Cycling Center, and Portland State University's Transportation Research and Education Center to conduct the evaluation of the project, which will be advanced through Metro's Regional Safe Routes to School network. Metro's role will primarily be to facilitate administration and oversight of the grant with match for the grant provided by PBOT and Oregon Walks. That's it.
Thank you.
Thank you.
All right, Counselor Communications. Counselor Lewis.
Sure, thank you so much, colleagues. I have a few things to celebrate. The first is that our Glean program, which is our artists in residence at Metro Transfer Station, has selected our 5 artists for this year. Epiphany Couch, May Ide, Diane Jacobs, Marsha Mack, and Chris Lale Larson are the 5 artists who will be able to complete their residence at Metro Central and in the late winter, early spring display their works. So that's super exciting. And that's a partnership 3 ways between Metro as well as our transfer station contract operator and a nonprofit Crackpots. Also wanted to let y'all know that I did attend the Tri-County Planning Body meeting last Wednesday. And the report that was accepted last week was around workforce and alternative workforce training and certification programs. Really important to recognize that so many folks who want to do this work, who are best situated to do this work because of their personal lived experience, get barriers for moving up because they don't have $40,000 to $50,000 to sink into a formal training program for work that they already know how to do. So really good report, several different alternatives presented, and there's going to be a pilot that involves all 3 counties and a small cohort that I believe begins in January. And then also wanted to report back, I had the opportunity to meet with leadership of the Yakama Nation when they were in town last week. And we discussed several items of concern around Willamette Falls. Thank you.
Thanks for the update. Okay, well, saying no further discussion, the council meeting is adjourned. Our next regular meeting is scheduled for Thursday, November 21st, 2024 at 10:30 a.m.